Good evening. Welcome to tonight's presentation. And I want you to know how much I appreciate you coming here this evening.
5 years ago, I was interviewed for a job here at Byram Hills, and it was by special request of the families within the Armonk district that a physician be on board and attend football games. And it was the main reason why they asked me to come. I was known to enjoy athletics as a pediatrician. In my private practice, it was mostly in the afternoons, was all athletics. And for many years, I've attended football games as the school physician. And so it was my hobby, and I was now privileged past 5 years to actually perform this function on a full-time basis without having to go to the office, without having to necessarily see sore throats and colds, but to attend and manage the things that really most interest me. This is the main reason why I'm really happy to be involved in this program tonight, because what we're seeing here is a holistic approach to athletics, not just showing up on the lacrosse field and starting your practices that day, but to ideally be prepared for the lacrosse season well in advance, and to consider many other things besides the physical aspect of cradling a lacrosse stick. We have to keep in mind many of the things that are going to be discussed this evening, so I won't continue to speak. I'd like to get to the speakers as soon as possible. One of the other things that I do here for the school is to manage the concussion protocol. And whether you like me or you don't like me because of the concussion protocol remains to be seen. The important thing is that we now have a concussion protocol which is embedded within the school and is also being practiced in the 7 other districts that I function as a medical director for, so that all of the athletes in the northern Westchester area and southern Putnam are being managed post-concussion in exactly the same way. It's important so that we can get students back into the field, back into practice as soon as possible. The concussion policy and protocol does not delay your return to athletics, it actually shortens it, so that we really appreciate if you have a head injury to report it to the athletic trainer or to your coaches, so that we can implement the concussion protocol and get you on the way to recovery. Now, our program this evening takes on a slightly different aspect. We're not going to talk about concussions so much as the holistic approach to managing, the athletic body and mind. And without much further ado, I'd like to introduce the first speaker, Dr. Mark Kowalski. So without further ado, I'd like to introduce Dr. Mark Kowalski.
I'm going to be talking about the healthy athlete, hydration, nutrition, supplements, and a bit on performance-enhancing drugs. But before we get there, we were asked to just talk a little bit about the question of sports specialization. It's a question of sort of increasing importance in our time, and I think athletes and parents are wondering whether sports specialization is helpful or harmful in cultivating an elite athlete. So first, just some definitions. Sports specialization is defined as participation in intensive training and or competition for at least 8 months out of the year. You, by definition, participate in this one sport at the expense of participating in other sports. And early sports specialization, which is one of the questions being asked, occurs in prepubertal children or children before the 7th grade or before age 12. And again, by definition, specialization in a given sport typically comes at the expense of overall free play, which is incredibly important, particularly in the younger age groups. So with regard to sports specialization, there are 2 fundamental questions we have to ask. Number 1, is sports specialization safe? Or does it in fact increase the risk of injury in a youth athlete? That's number 1. And number 2, Is it effective? Obviously, the reason why kids and parents are choosing early specialization is an effort to become an elite athlete. So can we answer the question about whether this is even possible? Does specialization lead to elite status? So I'll try to touch on them very briefly. What we know about the risk of early specialization is, number one, kids that specialize earlier in one single sport execute less of the age-appropriate skills well, and this increases their risk of injury. The common example is the pitch in the throwing athlete. If you can't perform a proper pitch from a biomechanical point of view, you're more likely to become injured. Number two, kids, when they specialize early, don't develop the protective neuromuscular patterns that are required to prevent injury. And what we find is that when you increase organized play at the expense of free play, or when kids specialize before the age of 12, their risk of injury increases substantially. And this isn't just a Gestalt notion. This has actually been proven in sports medicine literature, validated, peer-reviewed research. In hockey, the earlier you specialize, the more likely you are to develop a labrum tear in your hip. In tennis, the earlier you specialize, the more likely you are to develop hip impingement. And of course, we know that in baseball, the earlier you specialize, the more likely you are to develop a shoulder or elbow injury. So this has now been proven and is accepted research. There's another effect of early specialization, and it's not physical, it's psychosocial, and it's psychological burnout. This is often due to the adult-driven specialization that occurs in this context. And the characteristics of psychological burnout include loss of motivation, lack of enjoyment of their sport, which is typically more important in the younger age groups, high stress and anxiety, and ineffective coping strategies with this stress level. And if a kid happens to develop an injury at a younger age, then they're likely to develop a fear of re-injury with later participation. The manifestations of psychological burnout are widespread. They can be quite serious. An athlete can demonstrate mood disturbance or even mood disorders, including true clinical depression. They can demonstrate social isolation. Eating disorders can sometimes be reflective of psychological burnout. And then the feared consequence of actual dropout from the sport altogether. And again, this has been proven in research. The earlier a swimmer specializes, the less likely they are to participate in national team competition. The more off-ice specialization occurs in a young hockey player, the less likely they are to continue playing hockey at a later age. So this psychological burnout and dropout is as serious as the physical demands placed on a specialized athlete. Well, what about the question of, does specialization accomplish the goal of developing an elite athlete later in life? And the answer seems to be no. There's a variety of ways of looking at this question. First, looking at kids that specialize early and then seeing if they become an elite athlete later in life. And you can look at Russian athletes or German athletes that are selected at an early age to train to become elite. They only have somewhere between a 0.14 and 0.3% chance of ever becoming an elite athlete. The other way you can look at this is to identify elite athletes and then look back retrospectively and see if they specialized early. And actually what we find is the opposite, that in the 2004 US Olympic team, more of those athletes specialized later in life than their non-elite counterparts. And then you can look at it even a third way and say, well, what happens to kids that diversify, that play multiple sports at a younger age? And it's true in research that the kids that diversified at an earlier age, meaning they continued to play more than one sport, were more likely to reach elite status. So the bottom line is specialization isn't even effective in generating an elite athlete. Well, what are the benefits of diversification? We're telling people that it might be dangerous to specialize, that it's not effective. There actually are benefits to diversification itself. Number one, you enhance your physical literacy as a young athlete. You're more likely to choose a sport that you truly love because you've learned a variety of sports at a young age. You develop motor skill development and those protective neuromuscular patterns that are important to prevent injury. You develop healthy psychosocial and cognitive skills that are important in order to prevent that feared burnout. And then, of course, most importantly, it accommodates the psychosocial well-being of these kids at a young age. Well, there are a variety of ways to operationalize this rather than just telling people never to specialize at all costs ever. Number one, provide opportunities for free unstructured play, especially at a young age. Number two, the ratio of organized hours to free play hours should not exceed 2 to 1. Number three, the weekly hours of sports participation should not exceed the child's age to a maximum of 16 hours. Avoid specialization before the age of 13. It's been proven, again, not only to be safer, but also more effective. And finally, a structured strength and conditioning program, even at the younger age groups, is safe and effective in preventing injury if and when they do specialize later in life. So those are some comments on specialization, and I'm happy to address more questions during the question and answer period. But now we'll sort of pivot and discuss the other topics, including nutrition. So nutrition, obviously exceedingly important in maintaining optimal performance, and these are sort of the pillars of healthy nutrition. Number one, maintaining adequate caloric intake, maintaining a balanced diet, consistency and appropriate timing of pre-participation and post-participation food. And you'll see this sort of consistency theme reemerge, whether we're talking about nutrition, hydration, or sleep, for example. When we talk about caloric intake, we look at it as balance. We look at it as calories in and calories out. Of course, calories in are the diet. We're going to talk a little bit about that. Calories out have to do with the normal activities of daily living, digestion and metabolism, and then the unique physical activity that characterizes a competitive youth athlete. Based on age and activity level, you can estimate what caloric intake will be. And for an active teenager, you'll consume or require anywhere between 2,400 and 3,200 calories, so quite a bit. You just can't take in any calories, though. You have to have, again, a well-balanced diet. And this is what a well-balanced diet should look like for the average youth athlete. So about 45 to 55% of their diet should be the right type of carbohydrates. About a third should actually be fat, but the right kind of fat, and we'll talk about that. And then somewhere between 10 and 30% should consist of protein. So with carbohydrates, this should be the major source of energy. And the reason is that we use carbohydrates to synthesize glycogen, which is our body's fuel source. Now, how much carbohydrate you consume will depend in part on what type of activity you participate in. So an endurance athlete, for example, will consume 7 to 10 grams per kilogram per day. A high-intensity athlete will consume somewhat less. And then you want to make sure that you consume the right amount of carbohydrates pre and post participation at the right time, 1 and 4 hours before competition and 2 to 3 hours afterwards. Now, protein is important. Protein we use as the building blocks for muscle. And there's a recommended daily allowance for protein, about 1 gram per kilogram per day. And again, the type of sport you participate in will determine in part how much protein you should consume. But on average, youth athletes between the age of 14 and 18 should consume somewhere between 45 and 55 grams of protein per day. Now, more isn't always better. Diets exceeding the recommended daily allowance have not necessarily proven to be beneficial to the youth athlete. Well, how to operationalize this? Here are some examples of 10 grams of protein found in a half a chicken breast, for example, a cup of cereal, oatmeal, or yogurt. A variety of vegetables and healthy nuts can provide adequate protein intake throughout the day. Now, fat is an essential part of our diet. A third of our calories should, in fact, come from fat, but the right kind of fat. So what is the right kind of fat? Plant oils and soft margarines are an example. Avocado is a great source of healthy fat. And healthy nuts, again, are an incredible source of the right types of fats. These are the unhealthy fats that are often available to our kids, unfortunately, but the saturated fats, the trans fats, candy, fast food, processed food, these are all the wrong kinds of fats and should be avoided in an elite athlete. Again, timing of your meals is as important as the content. So pre-exercise meal should occur 1 to 2 hours in advance of participation, and it should be a relatively low-calorie meal, somewhere between 200 and 500 calories. Easily digestible carbohydrates. You want to avoid high-fat and fiber meals. Those should be reserved for other times throughout the day. And familiar foods. Before a weekend tournament, before a marathon is not the right time to experiment. We've talked about pre-participation nutrition, now post-participation or recovery nutrition. So there can be a couple different meals after participation, 30 minutes after, and then again 1 to 2 hours after. And this is important because you need to replenish the glycogen that you've expended during participation. So you want high carbohydrate, which is the source of the glycogen, a moderate amount of protein, and you want a nutrient-dense meal without any fluff. So again, how to operationalize this, these are some examples. A sandwich with vegetable, meat, and cheese is a good source. Quinoa salad with roasted veggies is a good source. If needed, and you have nothing else available, sports bar and orange slices can suffice. And that sort of brings us to the energy bar topic. This is sort of ubiquitous now. They're widely available. They're incredibly convenient. If you're going to use nutrition bars, you want to make sure that they have these healthy ingredients: seeds, nuts, peanut butter, whole grains, dried fruit. And there are certain things you should look for in choosing a good nutrition bar and a bad nutrition bar. Sugars should be below 10 to 12 grams on the label, and there should be sufficient protein, 5 to 10 grams. So you can see here, this column are the better choices, things like a Luna bar or a Kind bar. These guys are basically candy bars over here, like a Cliff bar, for example, probably aren't as advantageous. And now on to hydration, clearly as important as nutrition, and often off the radar screen of our youth athletes, particularly during the day. So what we know is that when you lose more than 1% of your body weight of water during participation, this has a detrimental effect on your ability to perform. And if you lose 3% or more of your body weight based on sweat, then you start to become at risk for heat illness, heat exhaustion, and then the worst case, heat stroke. What you see is that when these kids show up to practice, 3/4 of them already arrive dehydrated, so they're already a step behind the game. And here are some symptoms of dehydration. You can see here: thirst, irritability, fatigue, no desire to urinate, not thirsty. And there are ways to monitor hydration status. The most objective and easy way is pre- and post-participation weight. Now, that's not something you can do all the time, but it is probably worthwhile to do it as an experiment a few times just to understand as an athlete how much water weight you lose during practice and competition so that you can judge for yourself how much water to replenish. Urine-specific gravity is used at the higher levels, including US Rugby, and there is a thirst scale that can also be helpful. Here's what rehydration or prehydration looks like. Now you'll observe that most of this is water. Energy drinks are really not required, except in unique circumstances. So pre-exercise, 1 to 2 hours beforehand, 16 to 20 ounces of water. 30 minutes beforehand, another 18 to 16 ounces. During exercise, you should take about 4 to 8 ounces for every 15 to 20 minutes of participation. And of course, this will vary depending on level of exertion and temperature. If you're participating in sports for greater than an hour, then and only then is a sports drink required, and that sports drink should be diluted. Post-exercise, again, based on how many pounds you've lost of water weight, you want to replenish 16 ounces for each pound lost. And the only caution is here to avoid overhydration. Again, more isn't always better, and too much hydration can actually have a detrimental effect on your health by diluting the other electrolytes in your bloodstream. So on to sports drinks, again, only really required when you participate for more than an hour. And the ones you want to look out for, similar to energy drinks, or similar to nutrition bars, there are some guidelines. You don't want any more than 6 to 8% carbohydrate, and you want to make sure there's adequate sodium, 0.5 to 0.7 grams per liter, in order to make sure that you're replenishing the sweat nutrients. Okay, just some quick words about sleep. If you look here, 14 to 17 years old, the students at this school should get about 8 to 10 hours of sleep. Now that's a losing battle, we all understand that. So there are other things that you can do besides striving for that 10-hour holy mecca, and these are them. These are sort of how you achieve optimal sleep hygiene. And again, it's all about consistency, that common theme. So consistent waking and bedtime is very important. Avoid naps throughout the day. Don't lie in bed for more than 10 to 15 minutes struggling to fall asleep. Avoid physical activity right before bedtime, and arrange a cooling off period in anticipation of bedtime. Limit caffeine and other stimulants. And then again, consistent meals and adequate hydration. It's a feedback loop back into appropriate sleep. There are sleep aids that can help, typically not encouraged in a youth athlete. Anything more than an herbal supplement would be appropriate. And this brings us into dietary supplements very briefly. So 2/3 at least of our youth athletes and students in general are using some sort of supplement. And the reasons they use them, of course, are to improve performance, but also appearance. And that's where this topic sort of extends beyond the playing field. And these are the most popular: protein, caffeine, and creatine. So protein builds muscle. It's relatively safe without any significant downside if used appropriately. And there are a variety of proteins one can rely on. Whey protein is probably the quickest to digest. Creatine is very popular, probably not as benign or harmless as protein. It basically helps get the most out of your workout by stimulating a short-term aerobic activity. It's safe at typical doses, but can be dangerous with higher doses or with prolonged use. And the side effects are listed here: weight gain, water retention, nausea, vomiting, and some kidney side effects. So we want to be a little bit careful with creatinine. I include beet juice just because it's used at the higher levels of rugby and other elite sports. The theory with beet juice is that it dilates blood vessels, so it helps deliver oxygenated blood to the skeletal muscle. There's limited clinical trials, and admittedly, the evidence is hit or miss. But the good news is there's really no safety concern. And the way you'd use beet juice is basically 16 ounces at a time in anticipation of competition with no real adverse effects reported. Caffeine, we know about this one. This is a stimulant, and again, incredibly popular in our youth athletes, either in the form of pills, believe it or not, or energy drinks. And this is really appropriate only for adults only. And the reason is there's basically a wide array of side effects. The typical stuff: insomnia, restlessness, but you can also increase your heart rate and develop an irregular heart rate in the worst case. There are reports of sudden cardiac death with excessive use of caffeine. But just based on a performance perspective, it actually can stimulate dehydration, which again feeds back into that concept that the more dehydrated you are, the less able you are to perform, and the more at risk you are for heat illness. I'm just going to mention performance-enhancing drugs, and I'm happy to address it during the Q&A period to allow more time for the other speakers, but obviously a wide array of performance-enhancing drugs. It's a bit of an underreported epidemic in our youth athletes. They're trying for any competitive edge, and these are some of them that provide a competitive edge. We know about anabolic steroids. We know about stimulants, including caffeine and ephedrine. HGH is increasingly popular due to the fact that it's difficult to test for. Erythropoietin, more for our endurance athletes to improve their ability to deliver oxygenated blood to the skeletal muscle. If you're a fan of biathlon in the Olympics, propranolol, a beta blocker, can settle down the heart rate and let them hit the target. And diuretics are used not as a performance-enhancing drug itself, but as a masking agent to make these drugs harder to detect. So I'm going to pause there. These are the various national bodies that we work with to prevent injuries in youth athletes, including our own foundation and StopSportsInjuries.org, a wealth of resources for parents and athletes. And these are some of the professional societies that have provided some of the information in the talk, including the Academy of Pediatrics, College of Sports Medicine and the Society of Sports Medicine, the Dietetic Association, and the National Institutes of Health. I'm going to pause and pass the microphone back to the doctor, and look forward to answering any questions later in the talk. Thank you very much.
So this was going to be just a general survey about lower extremity injuries, how we treat them, how to prevent them. Certainly I would ask you to really take advantage of the fact that we want to answer questions at the end. Write them down. Whatever's on your mind, I'm more than happy to answer, as are the other doctors, because this is going to be pretty generalized. I'm going to touch upon injuries to the hip, to the knee, and to the ankle. With the hip, we'll go over some of the things you might see on the field, like hip pointers. We see a lot of strains and tendinitis. We see labral injuries, and I'll touch upon what the labrum is, what its function is, and what a labral injury is like. Knee injuries, we'll touch upon ligament injuries, especially the dreaded ACL tear, meniscal injuries and tendinitis, which are very common, and ankle sprains. So when we look at the hip, if you play football or rugby, it's not uncommon to either get struck in the hip or to land with a thud on the ground, and then you end up with a black and blue on the side of your hip. That's what we call a hip pointer. Really, it's a contusion. A contusion is a fancy medical word just for bruise. It's common in collision sports, and really the telltale sign is that you'll typically have a bruise on the side of your pelvis here. That's a black and blue. A black and blue is simply a collection of blood. This is benign. Usually what we'll do is we'll rest you up, put some ice, try some anti-inflammatories, and when you're comfortable to go back, oftentimes we'll consider some extra hip padding. Sometimes in serious situations, if you go to the doctor, if there's a big collection of blood, what we'll consider is trying to take out some of that blood to make you feel better. But for the most part, this is pretty well tolerated, just with some anti-inflammatories, ice versus heat, and rest. What about hip strains and thigh strains and tendinitis? We see this all the time. A strain is simply a stretching or a tearing of a tendon or a muscle. So that's the definition in brief. And usually we'll see these types of injuries when someone has an abrupt movement during a sport or intense activity without a proper warm-up. The muscles in particular that are prone to strains are the ones that cross two joints. So the hamstring, for instance, which is in the back of your thigh, crosses the hip as well as the knee. The calf muscle crosses the knee as well as the ankle. Those type of muscles in particular that cross two joints are very prone to stretching and to developing a strain. And we grade strains, just so you're aware, we grade them 1, 2, 3. So 1 is a slight stretch of the muscle. 2 is where some of the fibers may tear, but the majority are intact. And 3 is where there's a large tear of the muscle. How do we treat it? Well, your typical RICE protocol. Rest, ice versus heat. In fact, for muscle injuries, I tend to like heat. 15 minutes, you put a hot pack on. Compression shorts or a bandage are very important. So I find that those are really helpful. I had a hamstring injury recently, and I just wrapped it up with an ACE bandage. I thought that helped. Getting moving is really important. So if you have a muscle injury, you don't want to baby it too long. You do want to try and stretch it out, and you want to try and get the blood flowing. Oftentimes that'll make you feel a little bit better. Sometimes, though, you will have to take a break from sports. So depending on the severity of the strain, you may have to take a few days, maybe up to a week or a couple of weeks to get back. How do we prevent these injuries? Well, the more flexible you are, the less likely you are to really overstretch a muscle or a tendon. So it really behooves you and behooves us. It really is important to try and increase flexibility. Obviously, there's a limit. Some people are really limber, so some of the limber dancers that do ballet, for instance, they can really, they're pretty flexible, and then you see some guys who can barely get their hands down to their knee, much less touch the ground. So there are obviously limits, but trying to improve flexibility and doing an appropriate warm-up is really important. So especially in the wintertime, for instance, I see a lot of this, say with the adults, if they play sports outdoors like paddle tennis, they don't bother to warm up, it's cold, guess what? They end up having a muscle injury, oftentimes a calf strain, what we call sometimes tennis legs. So appropriate warm-up, 5 to 10 minutes, jog it out, and trying to maintain a consistent flexibility program. What's the labrum? So the labrum is an important structure in ball and socket joints. Let's take a step back. What's a joint? A joint is simply where two or more bones meet and motion occurs. The main ball and socket joints of the body are the shoulder and the hip. The hip, in particular, the socket is very round, the ball is very round, so it's very congruent. But the labrum also exists to try and deepen the socket further to increase stability. It also is a shock absorber, much like the meniscus is in the knee, and it provides a watertight seal so that the fluid that's circulating in the hip doesn't leak out, and so there's good motion in the hip. So the labrum, in essence, is the rim of cartilage that surrounds the socket. It's basically going all the way around this area here. This is a tear. So here the labrum is no longer attached to the socket. And that can happen through trauma. If you have a real severe injury, for those who remember, say, Bo Jackson 20-something years ago, I mean, he had a severe injury with a fractured dislocation of the hip, but that's one instance. Or you have an underlying condition called hip impingement syndrome or femoroacetabular impingement syndrome. What's that exactly? Well, that's when the ball is either too big for the socket or the socket is too big for the ball, and the labrum can get caught in between, and that's how an injury to the labrum can occur. How do we treat labral injuries? Thankfully, most of the time these can be treated non-operatively. Oftentimes, if someone comes to the office, we'll examine them, we may get an x-ray, we may diagnose impingement syndrome, maybe not. We'll try some rest initially, modifying their activities depending on the severity. If you can play through it, it's mid-season, I may have you continue playing. If it's really severe and hampering you, we got to shut you down. Oftentimes, 1 or 2 weeks of anti-inflammatories can benefit, and relieve some of the symptoms. We'll do a rehab program, so it really is important to try and work out the core muscles, the hip muscles, and we'll send you oftentimes to a physical therapist for a couple sessions just to get the hang of things. Then maybe you transition to the gym or just working with the trainer. In some situations, we may consider an injection to buy you some time and also to really correctly diagnose the problem. If the injection really helps, then we're in the right zip code. We know that it's almost certainly something deep within the hip joint like the cartilage or the labrum. We oftentimes will get MRIs to really look at it more closely, and really the last resort is surgery. And the way we do that is arthroscopic. Small incisions, about 1 centimeter each, 3 or 4 incisions around the hip. And that can get you back to playing sports. What about knee injuries? So ligament injuries are extremely common in sports. How do we prevent them? How do we treat them? We'll go over that a little bit here. The most common ligament injury we see, not the one we operated, but the most common one we see are MCL injuries. So MCL, or medial collateral ligament, is the ligament that exists on the inner side of your knee. So it's right over here. It's a pretty thick ligament, and it's a very strong ligament. And in this particular time of the year, we see tons of MCL injuries from skiing. It's the most common injury, common ligament injury in skiers. Ligaments, just to backtrack, are basically, you can think of them as the body's rubber bands that connect one bone to another to keep the bones from moving too far apart from one another. Much like strains, a sprain applies only to ligaments, and a sprain is basically a stretching, either a minor stretch, grade 1, a moderate stretch, or a complete tear, which is a grade 3. With the MCL, usually the force vector is inwards, so the knee falls in like that. Oftentimes people will say, oh, I heard a pop, or I heard a snap. They're usually able to put some weight on it, and usually you don't get the amount of swelling that you might get with other injuries like meniscus or cartilage, or especially ACL injuries. And the pain is almost, is very point specific. I put my finger on the inside of the knee over here or further down on the shin bone, and people will say, wow, that really hurts. How do we treat it? Well, low-grade sprains, I might put you in a short brace like this. It goes about a third of the way up and down, up the thigh and down the shin. It has metal bars on either side to control side-to-side motion. We'll get you moving immediately. You may be back in 1, 2, 3, maybe up to 4 weeks. But if it's a real severe sprain, one where the ligament is a grade 3 type of tear, oftentimes I have to put you in the big brace, the one that goes basically from the hip down to the ankle. You may see some people after surgery who've had it, and you'll probably be on crutches for a little bit. You probably won't be able to get back to playing sports for 4 to 6 weeks. And for that, we usually do formal therapy. Surgery, thankfully, is pretty rare. So unless the ligament is really torn off and is in a different zip code, these tend to heal pretty reliably because the MCL has a good blood supply. How do we prevent them? Well, sometimes there's no way around it. You're in the wrong place, wrong time. If you're one of the football players or rugby players and someone's holding you and you get chop blocked like happened to me, well, that's, there's no way around that. But having strong quadriceps and hamstrings and good balance is important. Sometimes you'll see, like if you watch a lot of college sports, college football, you'll see a whole crew of linemen with braces on. And there are some strength coaches and team coaches who think that the braces can prevent some of these injuries. The data is equivocal, meaning it's plus minus. There isn't really strong data to support it, but some guys are really adamant about it. I don't see it as much in the NFL. ACL tears, we'll go quickly. The ACL is the ligament that goes from the thigh to the shin bone here. It's really important in controlling front-back motion of the knee, and it's critical when you cut or pivot, because when you pivot or push off, you straighten out your knee, and what happens is the thigh bone will move backwards on the tibia or the shin bone. It's critical, especially for sports like basketball, soccer, football, rugby. It's the most common ligament injury that we'll operate on. How do we treat it? Well, unfortunately for younger athletes, it's almost always surgery because the risk of future injury is very, very high. So we worry about the meniscus or the cartilage because there are a few things we can do to really help that. Obviously, there are surgeries we can do to treat meniscus and cartilage injuries, but it's best never to have them. The ACL, though, we have very good techniques to reconstruct it. We don't repair it, we don't stitch it back because that doesn't work. We have to replace it with a ligament, with a tendon that functions as a new ligament. So how do we prevent it? Well, it's really important to try and consider doing these ACL prevention programs. And just like Dr. Kowalski said, consistency is the key. You do 15 minutes of this before each practice. You can decrease the risk of ACL injury by up to 40–50%. As someone who had an ACL injury, I can tell you I wish I never had one, and having treated hundreds of people with ACL injuries, it really helps to never have an ACL injury. Briefly, you do a warm-up, you do a strengthening portion, plyometrics where you do jumping and ballistic type movements, agility training, and stretching. These are well-written documents that you can find on the internet or on our website. The key is you want to eliminate the knee buckling in and the hip drop. So if you go up for a rebound, you don't want to come in, you don't want to come down like this. That's a recipe for disaster. You want to try and land with the legs further out, and you want to land the right way so that you can prevent these injuries. Meniscal injuries, the meniscus is a shock absorber. We're running out of time, but oftentimes meniscus injuries, if they're small, we can leave them alone. If they're large, we sometimes have to operate on them. Tendinitis, the quad tendon inserts onto the knee. This is the sideways view. So kneecap, thigh bone, shin bone, quad tendon, patellar tendon. People who have pain in the front of the knee oftentimes have patellar tendinitis. The way we treat it is with ice, anti-inflammatories, sometimes a patellar strap and a rehab program. The key is try not to overdo it. So if you're on 3 basketball teams at one time, you're probably going to get this, so try and cut back. Other sports we see it a lot in are lacrosse and soccer. And then finally, ankle injuries, 2 types, high ankle and low ankle. High ankle sprains are less common. Low ankle sprains, much more common. Low ankle sprains involve the ligaments on the side of the ankle, and it involves a twisting injury. High ankle sprains take a lot longer to recover, 3–4 weeks if not longer. Low ankle sprains, the typical ones, maybe 1 week, maybe a couple days, maybe up to 2–3 weeks. If it's really bad in the beginning, I'll put someone in a boot, ice you up, but get you moving immediately. You don't want to try and, you don't want to just sit in bed all day for 5 to 7 days. You're going to get stiff, and you're going to delay your recovery. You want to try and mobilize quickly. We do early rehab programs. The key here is strengthening, so especially the muscles on the side of the ankle. These muscles here that are the everters. Balance training, you need good balance to prevent the ankle, especially in single leg type activities from twisting. And flexibility training, sometimes people need orthotics. So I'll leave it there. Certainly ask me questions afterwards. Happy to answer them. I know we got to get moving. So, all right, thank you.
So what I decided to do is I've been talking to different schools in this area. What they share to me about their stressors is something that I have compiled and put on bullet point. And I want to know if, by any chance, it also happens at Byram Hills. So this is what I was told by other schools in the area. Let me see. So, what about test-taking stress, college admission stress, grades, GPA stress, social media stress, family dynamic stress, meeting other expectations stress, romantic relationship stress, peer dynamic stress, time management stress often lead to not sleeping enough hours, sports achievement stress, and sports injury rehabilitation stress. So this is what I was told in other areas. So my hunch is that most likely these are common stress that happens pretty much to everybody. And the goal is really not to avoid stress, given that we cannot do that. Physiologically, we are unable to avoid stress. A better coping skill is to have tools and abilities and strategies. So when those stressors come up, we know what to do. So whether we are a tennis player, whether we are about to serve the first match, or whether we are about to serve at nationals, basically it's the same serve. What we perceive coming from the outside or from the inside is what really triggers what happens inside our body. So normally we have an arousal happening inside of us that leads to stressors. And that arousal is not different from having a lion in front on the other side of the court. The body does not distinguish or make no difference whatsoever what the stressor is. However, what's more important is what I perceive the stressor to be. So the kicker, about to kick a penalty kick, most likely made this kick 1,000 times. However, the expectation of, I have to make this kick, or if I don't make it, therefore there goes my dreams to possibly go into my college that I want to go to, or the fear that maybe if I miss the kick, I may disappoint coaches, teammates. There's a lot of thoughts, emotions, and perceptions that trigger automatically and instantaneously how the body responds to what happens on the outside. And again, this is just like a tiger. The body does not distinguish the goalie, the kick. It's just a pure and natural arousal. Just like taking a test. That student may most likely have some feelings, emotions, and hopes that if I have to do well in a test, if I score high, I may go to school that I want to, and I feel the pressure that unless I score that high score, I may not achieve the goals that I wanted to succeed. So the stressor alone, just like the tennis player, the soccer player, the test taker equally had the same physiological response, because that's how the body perceived the outside as it was a real a threat, and it's an instantaneous and automatic physiological response. So why does that happen, and why this is really matter to us? Well, because the awareness of what happens to us leads to having emotions, to thoughts, and then muscle tension. And this becomes an ongoing cycle. And normally, the stressor will typically go to having strong emotions, having maybe very upset and I'm not achieving to my expectations, then to the thought that what's wrong with me becomes really critical, I cannot believe I'm doing this, and that leads to muscle tension, and the more tense my muscles feel, most likely then my performance will decrease. If my performance decreases, then I feel more upset, and then my thought continues being more angry and being more critical. So this is ongoing cycle that unless we're able to stop and be aware of this, will continue on and on until we really come out of the court or field feeling very, very upset and disappointed because I am underperformed. So we cannot underestimate or undermine how we, or what we say, or how we think, or what expectation we put in ourselves, and how those expectations are perceived and how the body responds. In a way, this is the Roman god, Janus. We make almost no difference what happens in the past or what happens in the present. The mind needs to go and seek potential threat all the time. So we look for what happens in the past, and if we are stuck in what happens in the past, thinking, I cannot believe I just lost the last 3 points, therefore I may lose the game. If I lose the game, I have to lose the end of the match. So the mind is centered on what happened in the past. Or can move forward, meaning if I don't make this second serve, I will double fault. If I double fault, then I will lose the game. I cannot believe I'm going to lose this match. So it's very easy that the mind can shift back and forth, and the challenge is to be aware that the brain is going one way or another, back and forward. And if we are able to be aware of that and be in the present moment, that's the key. The key when we achieve peak performance is not to avoid the mind going back or the mind going forward, but that's a physiological part of being humans. However, the key is that I am aware that my mind has gone back or going forward, and take a pause and bring something that can help me to be in the present moment. Because it is in the present moment that we really achieve our best. So, for example, one of the routines that athletes have is, for example, people have seen Rafael Nadal, for example. Every time he serves, he has this routine of going like this. I don't know why he does that, but my hunch, most likely, is that that routine helps him to stay more focused. And because he does that, he's able to put aside as many distractors as possible. Other players, for example, you've seen baseball players. They play with the gloves before they go at bat. Or they see, for example, golf players. They have these pre-routine shots. They step behind the ball, they look at the target, and then stand by the ball, and hit it. So all these routines are very mechanical, but they have a purpose. And the purpose is that that's their way, and their way only, so that they can manage the emotions. What may work for Nadal may not work for Federer. It doesn't really matter. What matters is how each person individually, you identify what works better for you. So who practices mindfulness? Because that's a way of trying to get some self-awareness. Kerry Walsh, this is the Olympian volleyball player, just won gold medal at the Olympics in Rio. Russell is a quarterback for the Seattle. Now his teammates, these are 6'4", 320-pound linemen, and they practice mindfulness. Right? LeBron James, this is a softball team, and classrooms. There's something about that I find is that, what about mindfulness? Why mindfulness is helpful to me? And it's helpful to them because what they have found is that they have found a way that they can help them to be centered, to be present in the moment. So when they are aware that their mind has shifted forward and back, I can be aware of those experiences, and rather than negate them or pretend that they're not there, it's in fact the opposite, it's to embrace them and bring them back to the center moment. So mindfulness, in other words, is a way of saying awareness. It's awareness of what is a well-renowned John Kabat-Zinn. And basically what he says is just aware of the present moment. I mean, the present moment that we are here, that we are sitting at this chair. That chair may be comfortable or uncomfortable. That about this presentation, just be aware of this. And the mind may be going forward and think, oh, what am I going to eat tonight? Or thinking I have a test tomorrow. Yes, the mind can go there very easily, and it will happen. And if it does, just be aware of that and bring it back. So mindfulness is not about blocking thoughts, but basically it's to be aware with what happens. And some of those thoughts can be comfortable or uncomfortable. For example, there was an interview that took place yesterday. There was an ice skater that competed at the Winter Olympics. And he was interviewed after the performance. And he was asked, well, what did you feel coming up before you step on the ice? And he said, well, I felt like wanted to puke right? And then I wanted to go to the judges and ask, hey, do you have some Xanax for me? But in a way, he was embracing the moment. I mean, he was so nervous. But who wouldn't be nervous? This is the Winter Olympics. I mean, you're representing the country. This is one in a 4 years opportunity that you have that possibility to compete at the very highest level. So rather than negating and pretending, oh, I am cool, I'm fine, nothing's happening to me, I'm not nervous, that actually leads to a higher level of arousal. If we do the opposite of embracing what's happening, actually, that embraces what happens in the moment, and the nervous system will find a way to self-soothe. And that helps us to really perform at the highest and better level. So to be more aware is actually much, much better than being not aware. And also, the awareness, creating the capacity to be an awareness, is creating that link between the high arousal, the emotional arousal, and the impulsivity. If there is no pause in the middle, my emotion will take over. Most likely, when I am upset, as a tennis player, off goes the racket, right? But if I am aware that I feel upset, then the exercise of bringing some self-centeredness and pause and be aware in the moment will help me to be aware with the sensations, be aware with emotions. And that pause will then help me so I have more clarity and thinking in the process. Right? So it's all about finding a way to self-regulate emotions. So the challenge is that because we are not born being mindful, we have to practice it. No difference from practicing to be studying for social studies or practicing to be a better skier. We have to practice it. It's a practice. It's not that some people have it or don't have it. We are not born being mindful. This is based on 2012. There are 477 journals that wrote about the benefits of mindfulness, and this is what they came up with. Oh, the very huge list of benefits. I'm not saying that if you practice mindfulness tonight, therefore you will be sleeping better tonight. It doesn't happen that way. However, the more we practice it, begin to integrate it, maybe start with 1 minute, maybe extend to 2 and 3, eventually the body will find a way to self-regulate. And the better it's able to self-regulate organically by itself, then they feel calmer, more energetic. Then cortisol levels, which is the stress hormone, most likely will be lower. And as a consequence, I will be able to sleep better. So it's a cycle of practice. It has a cascade effect that the more we practice it, it has multiple benefits. This is actually me. This is in Tibet. I was there with my wife and daughter. I said, this is a wonderful place. So different ways of practice mindfulness. We can do walking meditation, we can do eating meditation, breathing meditation. The practice of the one that we do the most is the breathing meditation. Basically, it's about paying attention to your inhale and exhale. Every one of us knows how to breathe. It comes automatically. However, paying attention to the inhale, exhale brings a different type of attention. It's just noticing how my inhale takes place and my exhale is taking place. And when we bring awareness to that, most likely what will happen is that the busy mind will take over and the thought will pop up very quickly. And it's very easy that even though if I'm trying to pay attention to my breath, by breathing, I'll be caught up with the thought, and off I went. And I lost track of my breathing. So mindfulness is really not about preventing thoughts from coming around our heads, but rather paying attention to the thought. I say, oh, okay, there's a thought. And back to the breathing. And the more we practice going back to the breath, back to the breath, back to the breath, what we are doing is expanding our resiliency, our awareness and possibility to be in the present moment. And the more we practice this sense of being in the present, being with the breath, 2, 4, 5, 10 minutes, the more the brains begin to understand that I can go back to this experience and create this present moment awareness. And when I am in more present moment awareness is when I can really achieve peak performance. These are some of the apps that I find very useful to practice. The one I use the most is Headspace. It's quite interesting. And again, I mean, mindfulness is about being with emotions, with thoughts, sensations. And each one of us already has, and it's very, we have qualities who makes us to be very strong people. We are very compassionate, we are very smart, and very kind. That's in all of us. Sometimes stress can overshadow those wonderful qualities that we have. And if we practice more the essence of mindfulness, then we will be able to manage those stress responses, and those qualities that we all have will come forth more frequently. So thank you very much. I appreciate it. Thank you.
One of the things that I do here at the school is manage the concussion management protocol. And I just want to review that very briefly. I'm not going to bore you with the details. But the concussion management is evolved over the past several years and is still in a state of flux. And the current thinking in concussion management is, believe it or not, to get you back to active practice, get you back to school as soon as possible. Some of the principles that have evolved over the past year have been that when we say that you need to have total rest after a concussion or a head injury, and we were previously told that you can't look at a telephone, a TV, or any screen time whatsoever for several days, that theory is changing where the recommendation is just one screen at a time so that you're not trying to manipulate multiple things. Like my daughter who's doing her homework on the computer, talking to her boyfriend and looking at a movie all simultaneously. You really can't do that after a concussion. But if you just handled one screen and did it to tolerance or to the point where you're not having pain or unusual fatigue, then that should be acceptable. Also, getting back to activity, 2 years ago we were saying you got total rest for at least a week or longer. Now we're allowing more mobile activity in a sooner time frame. And lastly, about the impact study, one of the benefits of being at Byram Hills is that we have a high percentage of parents who allow impact studies done on their children, so that not only do we have the impact studies for athletes, we have impact studies done on the non-athletes. So if there's an automobile accident or a skiing injury outside of school, we have a comparison point to evaluate cognitive function. And this is the main advantage of the impact study that we do here, is that it gives me, in reading the impacts, an opportunity of seeing just how well cognitively the student is doing, both before the season and after an injury. And it gives an objective data point so that we can say, look, you need a little bit more rest, or no, your impact is back to normal, so we can start pushing ahead and introducing more in the way of cognitive learning. We do have a program called Return to Learn. We don't really talk about Return to Learn, but the teachers are very interested in this, meaning that when can we get an athlete who's been injured back into the classroom and functioning? If there's been a serious injury, of course, we want cognitive rest. But if the impact study is good, if the youngster is back to its pre-injury level on the impact, which is basically a neuropsychological study, much like a computer game, if you can function as well on the computer game after the injury as before the injury, then it correlates with how well you can do in the classroom. So Return to Learn is when can we get you back into the classroom and functioning? Okay, the first question is for Dr. Diaz. And any specific practices to help athletes prevent anxiety in competitive moments?
So what I do with athletes, I try to divide their performance in 3 steps. Step number 1 is how they prepare mentally before competition. Step number 2 is what they do to manage emotions while performing. And step number 3 is to do the homework and how did I do step number 1 and step number 2. What I do find normally is that athletes come in to perform hoping and overly trusting on their skills. And if they're doing well and they're winning, then they are very happy. But if they haven't done really the homework to be mentally ready before competing, and the opponent is really putting a lot of stress or competing at the same level, then you don't have an emotional or mental map. That means they become emotionally lost. They become overly concerned, overly worried, fearful, and that leads to what we call the cycle of overly stress and muscle tension. So what I try to implement is how they use either self-talk, breathing relaxation, imagery work, and those 3 strategies kind of tend to work quite well.
I have a follow-up question of my own, Dr. Diaz. As a parent, how do I prepare my youngster, or how do I deal with that same youngster who's now been in a football game that's lost at a high level of play, and the emotionality that goes along with being the losing team?
Yeah, so I mean, we all compete to win, and nobody likes to lose. That's for any level. What I try to convey is that everybody has his or her own learning curve. And the best experiences come when we embrace what just happened in my performance. And when I begin to understand, okay, what can I do better next time, that's the better approach so I can continue learning. If my focus is, what's wrong with me, I cannot believe I lost, blah, 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 that's naturally, in a way, creating a ceiling as to how to move forward. So, of course, there's some players that may naturally move quicker in the learning curve, and some may move slower. But there's no only one way of how this learning curve is designed. We need to embrace my own learning curve and all the pros and cons and learn from the experiences.
Thank you. Dr. Delos, at what age should we start to introduce ACL prevention exercises?
It's a good question. I think it should start from even prepubescent, but ideally, I would say junior high school and high school certainly should be practicing those ACL training programs. Truth is, it's pretty rare to have, although it's becoming more and more common to have an ACL injury in the prepubescent athletes, so below 12, although I just operated on someone who was 12 yesterday. Majority of ACL injuries tend to be in junior high and middle school and high school athletes. So those are the ones I would certainly emphasize, the training program. And it works. It just involves a commitment to doing it before practice and continuing to do it consistently.
Thank you. Dr. Kowalski, any thoughts on ketosis and the ketogenic diet?
Yeah, there's a sort of renewed interest in alternative diets, ketogenic being one of them. I think that for youth athletes, I'm not sure a ketogenic diet is appropriate. I think that what we're trying to do with our youth athletes, even through high school, regardless of their level of competition, is to adhere to basic pillars of nutrition that we talked about: balanced diet, adequate caloric intake, and making sure that you have the proper proportion of carbs, fats, and proteins as outlined. I think as you get into elite level performance in young adulthood, into the 20s and 30s, if the ketogenic diet resonates with you, it's fine to pursue. There's no evidence in the College of Sports Medicine literature that a ketogenic diet necessarily provides decreased risk of injury or a competitive advantage.
Thank you. I have another personal question. Tom Brady, who's into, or at least propounding, theories about diet, in conditioning, before the Super Bowl was speaking about how he took protein throughout the day, how every single drink was with electrolytes added to the bottle. And it struck me as he's taking too many electrolytes. You know, if it's continued throughout the day, is it affecting his total body electrolyte balance? Do you have any comment?
Sure. In the interest of full disclosure, I'm a Dolphins fan, so you have to take into account, you know, that I may not have bought his book, TB12. But I think that what works for Tom Brady may not necessarily work for a high school athlete, and I think that's really the takeaway point. The energy expenditures and the percentage body weight fluid loss for Tom Brady is altogether different than an average individual, one would assume. So I agree with you. I think that, again, basic pillars that we've outlined in this talk here, balanced diet, adequate nutrition, sleep hygiene, without any cutting-edge controversial philosophy, will empower an athlete to achieve elite status and minimize the risk of injury at the same time. I would agree. You, as I mentioned, only need to replenish electrolytes if you've exceeded a certain amount of exercise and a certain amount of sweat nutrients lost, which an average athlete wouldn't need, even a competitive high school athlete.
Another follow-up question. Much of the problems that I had attended to on the football field throughout this past season was cramping on, on days that it was really cold. Is there anything that we can do to prevent the leg cramps that occur during the course of play?
Sure, no doubt. Again, adhering to the nutrition and hydration. We talked about how 3/4 of kids will show up to practice and show up to a game dehydrated, and that can even occur on a cold day. I think that's the misconception, is that you can only be dehydrated in heat. Absolutely not true, because there's two pieces to the equation: inadequate hydration in and excessive fluid losses out. You can still have inadequate hydration in, and that's where a lot of cramping comes from. The second piece of cramping is the nutrition piece, and the third part of cramping is the stretching piece. And we know that rigid stretching, static stretching immediately before participation is not helpful, actually. A routine stretching program, a consistent stretching program that Dr. Delos talked about every night throughout the week to maintain flexibility and what Tom Brady would call pliability of the muscle is another important factor in preventing cramping.
Thank you very much. Dr. Delos, there's questions about shin splints and how to prevent them.
Sure. So shin splints, for those who don't know, involve pain along the lower part of the leg, typically on the inner side. Colloquially, we call them shin splints. In orthopedic parlance, we'll say that it's oftentimes a stress reaction, and in worst case scenario, a stress fracture. And invariably, when I hear of someone who is complaining or reporting shin splints, it's, say, a cross-country athlete who hasn't done anything all summer, and all of a sudden they're doing 4 or 5 miles at a clip and their legs are bothering them. It's the person who has upped the volume of activity abruptly without giving the body a chance to adapt. If you look back and you ask the right questions, you'll see that there has been some sort of change that has predisposed the person to this type of injury. And as far as what do you do about it, how do you prevent it, it's really all about developing a progressive schedule, not going from 0 to 100. But if you know you're going to do cross country in the fall, then start in the summer doing some jogging so that you get yourself ready, so that when you go in the fall, it's not all at once. The stress isn't all at once. Sometimes in very bad, and really what it comes down to is how much does it affect you? If it's a mild soreness, it may be something that we just watch and maybe you take a break for a little bit, or you just modify your activities somewhat. If it starts, and let's say it only occurs after you run for about half an hour. If it starts affecting, though, the quality of your life, or you can't even walk around the high school campus, or you can't go up and down stairs, or it's bugging you for the entire day after an activity, that's a real problem. And that's one situation where we may even consider an MRI, may even consider putting you on crutches to try and get it better. And an ounce of prevention is worth a pound of cure. If you end up getting a real significant stress reaction or stress fracture, even though you might think it's only shin splints, then you may be out of commission for 6 to 12 weeks.
Follow-up question. Osgood-Schlatter's disease.
Yeah.
Could you comment?
Sure. So one of those slides that had the sideways view of the knee shows what's called the extensor mechanism. And what is that? That means, you know, the quad is connected to the quad tendon, which is connected to the kneecap, which is connected to the patellar tendon, which is connected to the shin bone. So anytime you straighten your leg, you flex the quad, which pulls on the tendon, which pulls on the kneecap, which pulls on the patellar tendon. And anywhere along that line, anywhere along that chain, there can be a weak point. The weak point is typically the patellar tendon in adults, or the growth plate where the patellar tendon attaches in kids. And the growth plate on the shin bone is where Osgood-Schlatter takes place. These are, you know, scary sounding words: Osgood-Schlatter syndrome, Syndig-Larsen-Johansson syndrome. We call them syndromes. I always joke with people, it's scary, but the reality is all it means is that the growth plate is inflamed. And this is not a growth plate that's involved in getting you bigger or taller. It's a growth plate for the tendon itself. But this again goes back to how symptomatic are you? Is it something that causes some mild soreness for 20 minutes after a game? Well, maybe you continue playing, but you're mindful of it. You know, maybe you stop playing, you know, that extra sport on the weekends just to give your body a rest. But if you find that, again, after the game, I've seen kids that are crying after a game because of Osgood-Schlatter. I've seen kids that can't, like I said, can't squat or kneel, can't go up and down stairs, can't get up from a chair because it's so painful. Then you're going to be out of commission for a while to let the thing heal. So for the most part, it's a self-limiting problem. It's not a dangerous problem. It's not going to lead to arthritis, but it can recur until the child stops growing. And in boys, that can be 16 years old. So they come in at 12 and they've had this problem now twice in the last year. It can keep happening for the next 4 years. So they just have to be mindful of that. It's a matter of modifying activities, icing, and anti-inflammatories. No magic cure for it. You don't need an MRI for it. You don't even need an X-ray. It's pretty easy to do.
So if you're not in that much pain, you can play.
What's that?
If you're not in that much pain, you can
Well,
play.
you know, I mean, as a sports doc, the key is I want to try and get kids back on the field, but to do it safely. Osgood-Schlatter, again, is a relatively self-limiting problem, so I feel comfortable if they're in minimal pain, they notice some mild soreness, and it's a big game on the weekend, I'll let them play. But if it keeps becoming a recurrent problem and it starts affecting their life outside of sports, or even their ability to do sports effectively, then we have to, you know, recalibrate things and take a step back and probably, you know, give it a real rest. And by rest, I don't mean just one day. I mean maybe taking a week, 2 weeks, 3 weeks off to really let the growth plate quiet down.
Here's a parent question. No, I'll quote. When I was 35 years ago, I didn't know one athlete who had an ACL tear. Today, it's very commonplace. Can you comment?
Sure. You know, it's funny. You do concussions. I'm sure people, you know, we talk about concussions in football all the time. When I played in high school, I don't remember anyone officially diagnosed with a concussion. And I remember myself getting hit once in the head and seeing stars floating around. I didn't think it was a concussion at the time. You know, it was, quote, you got your bell rung. ACL tears, though, nowadays, back then it was a little harder to diagnose. You just relied on your exam. Sometimes you can be fooled on the exam, but an experienced doctor can usually diagnose it. You know, they have you lie on your back, they pull on the shin bone forward to see if it moves more than it should. We didn't have MRIs 35 years ago. We weren't more tuned to it as we are nowadays. And the reality is nowadays, young kids just do a lot more organized sports. It's like Dr. Kowalski said, if you're doing a diverse you know, array of sports and you do a lot of free play, injury is much less likely. One, you tend not to be as fatigued. Two, and fatigued also mentally. You know, when you specialize early on, I think specialization has been shown over and over in studies. Early specialization not only leads to psychological issues like burnout, where kids just retire. I mean, there was a great 30 for 30 on this Little League team where the 12-year-old pitcher was the best pitcher, you know, in Little League, and he never pitched again after the Little League World Series because he was so burnt out. So it's not only specialization causes that, but it increases the number of hours of exposure, and it's the hours of exposure along with some of the other issues we talked about that will increase the risk of injuries. And ACL injuries are going up. I think not just diagnosing them, but statistically, I think they're occurring more frequently.
Thank
I mean,
you.
would you agree?
Yeah, absolutely. When you look at injury surveillance studies, no matter what sport or what level of play, what you find is that ligament injuries like ACLs are much more common in competition than in practice. And one of the characteristics of early specialization is more competitions than practice, than an average kid with a free play or a diversified athlete. And that may be one of the causes of the many that Dr. Delos pointed out for the increased rise in ACLs. The other thing is young women and girls are participating in competitive sports at a much higher rate than they used to in past generations. And when you combine that with the fact that girls are uniquely at risk for ACL tears based on a variety of factors, how they jump and land, the anatomy of their knee, put those together, and young women are contributing to a large part in the increased incidence of ACL tears.
Yeah. I mean, young women, just to put in perspective, we always think of the football player who gets the ACL tear or the basketball player. Young women are 8 times higher risk than boys to get an ACL tear. 8 times, 8 to 10 times at the college level or the competitive level.
Thank you. Dr. Kowalski, could you speak on the benefit of speed, strength, and agility training?
No doubt. So I touched very briefly on the importance of strength and conditioning, particularly in specialization, but really across the board. There used to be a reluctance for parents and coaches to enroll young kids in a strength and conditioning program. And now we have evidence and consensus statements from every professional society that's relevant: Strength and Conditioning Association, American Physical Therapy Association, the College of Sports Medicine, and the Society for Sports Medicine, that strength and conditioning is not only safe but effective in improving performance and decreasing injury. So I think there's an incredibly important role. The key point, though, is that it has to be age appropriate and level appropriate. So a 9-year-old can, in fact, safely participate in strength and agility and conditioning programs. It just has to be age appropriate for that 9-year-old, whereas a 17-year-old football player who's on his way to a D1 program is going to have a strength and conditioning program that obviously looks altogether different.
Dr. Delos, what are your thoughts on foam rolling?
I think it's useful. I mean, I certainly do encourage people to consider things like foam rolling and to try and increase flexibility, especially of the hip muscles, the IT band. I find that foam rolling is useful. Is it a cure-all? No, but I think that it is something you can use in your armamentarium along with a generalized stretching, strengthening, and flexibility program. The one thing I would definitely emphasize in general, I know it's a little off the topic from foam rolling, but strengthening the core and the hip muscles pays dividends for a lot of lower extremity injuries and a lot of lower extremity maladies. If you have strong abs and low back as well as hip muscles, namely the hip abductors, the ones that bring the leg outwards, you can eliminate or reduce a lot of knee pain and a lot of other issues that can occur lower down the chain. Again, chain, it's the kinetic chain we talk about, at least in orthopedics, from the core down to the ankle. So,
Dr. Kowalski, for someone who started running at age 14 and is now a 3-season runner, is diversity still necessary?
It is actually probably more important. So there's sort of categories of athletes, and we talk about early specialization, the benefits and disadvantages differently. So there are certain sports where early specialization is actually okay or tolerable, and those include sports where these athletes mature from a skill point of view at a very early age. Figure skating, diving, and gymnastics are those where we might tolerate early specialization because they might reach their peak at 14 to age 16. There are certain sports that I touched on, the more common sports that we take care of: lacrosse, hockey, football, and the list soccer. Those are ones where we really discourage specialization, at least until age 13. What we know about the running sports and the endurance sports, when you look at elite level runners, they actually mature in terms of peak performance at a much later age. So not only is it detrimental from an injury risk point of view, but it's the least important in terms of reaching elite status in a runner. So absolutely, for a runner, diversification is key.
Thank you. Another question, Dr. Kowalski. This is a research question. I find it very interesting. What is the utility of stem cell injections for femoral labral tears?
Yeah, and I'll answer briefly and then pass over to Dr.
Okay.
Delos. So this is a question that's in the basket of what we call biologics, or what others might call regenerative medicine, or using biological tissue from the patient or from a cadaver to enhance healing of injured tissue. These include things like platelet-rich plasma, where you draw blood, spin it down, concentrate the important platelets and inject it back in. Stem cells, another category. Amniotic fluid is a third. It's controversial, and I guess I'll offer a general thought, and then I'll pass to Delos for specific thoughts on hip impingement and labral tears. These are promising technologies based on their theory and philosophy, but in each and every one of these, evidence is mixed at best for a lot of the reasons that they're currently being used. So in our group, we tend to take a bit of a dogmatic approach, where we try to take a step back, assess the body of evidence, and only encourage patients to consider something like stem cells if there is a trend of evidence that it would be helpful. So we tend to have a healthy skepticism with biologics right now, although we understand that they do offer promise. And I'll pass to Dr. Delos for more.
Yeah, I would agree. I mean, I think biologic therapies are going to be the way of the future. Personalized medicine is going to be the way of the future, et cetera. But in this specific instance, when we're talking about stem cells, yes, stem cells are a very attractive option. The problem is we just don't understand how to use them very well at this stage. Probably 5, 10, 20 years from down the line, we'll be using them in a much more sophisticated manner. The problem is now it's much more of a shotgun approach. I take some stem cells from you, and then I just inject them sort of blindly into your joint. The bottom line is there's no data that it helps regenerate a hip labrum, so I can't, in good honesty, recommend that you use it for that. If you've exhausted all other options and you're adamant you don't want surgery, biologic therapies are safe options to consider. It's just that I can't give you a predictability. I can tell you if you have ACL surgery that you're going to be 95% satisfied, etc. If you have a hip replacement, you're going to have 95% satisfaction. Your life will be changed. With biologics, I cannot give you a quote. I mean, it may be a home run. You may not notice any difference. That's where we're at in 2018 at least.
Thank you. Dr. Diaz, here's an interesting question. The question here asked, mindfulness is wonderful, but how do we bring it home to our kids? And how do we implement it in school?
Yes and yes. Sorry. So mindfulness can be brought in and be taught at a very early age. So there are exercises that young kids can do about how to even begin to either eat mindfulness, how to even breathe, and how to exercise. So that can be incorporated from a very young age. There have been many programs that are beginning to teach mindfulness in schools from the young age, from kindergarten and first grade. So these programs are already implemented with a very good outcomes.
Thank you. Well, that completes all the questions that I've been given. Are there any more questions from the audience? Well, I'd like to thank the three of you. This was really a great evening.